Hi everyone, today we've done a little bit of a shorter version, but we're going to do the long, more in-depth version as to why discs degenerate and what the actual physiological pathways are of that, okay? So what I want you to first remember is the disc is made up of three things, okay? The nucleus pulposa, which is like the yolk in the middle of an egg, and then you have the annular fibers, which are the ligaments that hold that yolk together, so think about the white in an egg, and also the end plates, okay? Now these end plates are actually extremely important because it's not just where the ligaments attach into, but it's also how the blood supply is shunted into these tissues, because that's the only way that this disc can get any blood supply is through the end plates, okay? And then it's really important to remember that the nucleus pulposa is really high in water content, and that's why this can naturally degenerate in time, and that when it loses water content it starts to become harder, which can further lead to more damage to the end plates, because when it has compression loads particularly, that can start to press into the bone plate, into these bones, and instead of them expanding out, they can cause damage and you can start getting modic changes, etc. So what is really important to remember is the disc degeneration pathway starts when there's destruction or damage to the annular fibers, okay? So what happens is the annular fibers can either be pressed upon or be put into a mechanical overload position from the nucleus going out because of maybe the degeneration, an older person's, as the nucleus pulposa's age has become harder, and that started to press more and more on those ligaments, or some mechanical loading, okay? So what you see here is you release the pro-inflammatory cytokines. Now they're inflammation, they give pain, but also they release other enzymes that regulate your MMPs, which is your metalloproteinases, which are what stop your proteoglycans from regenerating. Now it's really important to remember that these tissues in the annular fiber are made up of pretty much collagen and of proteoglycans, and so that's why it's stopping that new growth of those tissues is extremely important. Now the other thing that's really important to remember is one of the pro-inflammatory cytokines that released is your TNF, okay? Your tumor necrosis factor, which is a really strong inflammation, and it stops the repair by upregulating these MMP genes, okay, like we talked about there, and the production of IL-6s and IL-8s, etc. And these all block collagen synthesis and proteoglycan synthesis, and this increases inflammation, of course, and stops repair. And so the cycle just self-perpetuates and continues. Now, that is why the discs keep going, but what's really important to remember is what happens with the end plates because of this, because you need to see it as a whole picture so you can really understand where the pain is coming from, but also why and how doctors and practitioners should be really trying to approach healing these issues or trying best to alleviate patients' pain, okay? We're going to do that in a later video.